Alrighty. This is the Making the Most of Medicare presentation provided by New Mexico Aging Services Department. I am Melissa Luna, the Southwest Ship Coordinator for New Mexico Aging Services Department. I'd also like to include my co-presenter to introduce herself. Go ahead, Kelly.
Hi, good morning, everyone. I'm Kelly, and I am with the New Mexico Senior Medicare Patrol. And I'm so happy that you all have joined us this morning.
So a couple of things that we would like to share with everyone. We would like this presentation to be interactive. So if you do have a question, feel free to raise your hand or provide your question in the chat, or simply unmute yourself. And at a time where I've paused for a breath of air, you can go ahead and ask your question then. We would like to make this as if we were all sitting in an office together or in a conference room and asking questions and interacting. We find it best to be able to provide the answer to the question that you're asking. Hopefully, we've got all those here today for you. And if not, we will get the answer to you after the presentation if that's something that we are needing to do. All right. Okay. First and foremost, we do have with our agency a land acknowledgement that we would like to provide to everyone here. We would like everyone to know that we gratefully acknowledge the Native peoples on whose ancestral homelands we gather, as well as the diverse and vibrant Native communities who make their home here today. So here's an overview of today's topics that we are going to cover. Today we are going to cover what is SHIP and SMP, understanding Medicare, what beneficiaries can do during Medicare fall open enrollment, red flag, excuse me, fraud red flags, and the Aging and Disability Resource Center, also referred to throughout this presentation as ADRC, the fall open enrollment hybrid counseling. So what is New Mexico SHIP? SHIP is an acronym that stands for the State Health Insurance Assistance Program. Under this program that we have in our department, we have federal partnerships with the Centers of Medicare and Medicaid Services. We actively participate in conferences and in training so we can get the most up-to-date current information so that we are well versed in it and we can share it with our community. When we do that, we provide that counseling to any beneficiaries and their families who are seeking information regarding Medicare and some Medicaid. We provide education in various forms, such as outreach. We do those in person. We do some of them virtually, as you all can see today. We do them at community centers, senior centers, libraries, anywhere that a group of beneficiaries are gathering and are requesting some information in person or virtually. All the information that we do provide is free and unbiased. We do not endorse any insurance companies or any agents or brokers. We just provide all of the unbiased information so that a beneficiary can make the best decision for themselves for the health coverage that they are seeking. The people who are actively on Medicare is who we love to give the information to, as well as their family members and their caregivers. Because as we all know, as we journey through life with Medicare and just our whole life in general, we have a support system. So typically our support system is our family members and caregivers, relatives, friends, neighbors, people that surround us and are genuinely invested in our health. So we provide all of the counseling information, everything that we do to anyone who's requesting it. And Kelly's going to give you some information on what is SMP.
Thank you, Melissa. The New Mexico Senior Medicare Patrol is the sister program to SHIP, and this is the part of the department that helps prevent, detect, and report Medicare fraud, waste, and abuse. We also have a federal partnership with CMS, the Centers for Medicare and Medicaid Services, to provide advocacy, education, and outreach. And now that we're getting into Medicare open enrollment, you may have been approached about your Medicare or asked for your information. And you want to be very careful about that. And we'll talk more about that later on in the presentation. Missy?
Thank you, Kelly. Okay, so those of you who are here, I'm going to assume that you went to our beautiful website, which you can see now on the screen. The website is where most people go to access resources from the comfort of their home, any time of the day or the evening. On the top left-hand corner, you can see our website, which is aging.nm.gov. This is just a piece of the landing page that you arrive at. I would like to really emphasize that this is just a piece of it. These are some of the resources that are available to you any time of day or night when you have some questions or seeking out some resources. So if you look at a couple of the tiles that you see here on our screen, for example, I'm going to point out somewhere kind of in the center, you see there's an individual with a big heart on their chest that says New Medicare. Very new program to the state that we are not going to cover today, but is a very great program. If you clicked on the Learn More ribbon there, then you would get the information instantly. And the great thing about our website, this is also a location that if there is an application that's been created for online ease, you can also apply for a program right then and there. There's also phone numbers, email addresses for some of the resources and the partnerships that we have. So it's a great website to gather some resources for yourself if there's something that you need. Please do always look at our news and events section because we do offer lots of services and presentations as we're doing today throughout the year. Okay, so we're going to dive right into understanding Medicare. Everybody here may already be actively enrolled in Medicare. Some may be new to Medicare. So we're going to talk about briefly understanding Medicare. You have two options when first enrolling or being enrolled in Medicare. You've got the two options, one of them being Original Medicare or the Medicare Advantage Plan. There is not one to favor or the other. That is for you and solely you. You would favor what is best going to cover your specific healthcare needs and prescription coverages that you are needing. If you look on the left-hand side under Original Medicare, it's kind of like an a la carte coverage. You can pick and choose some of these coverages. Some of them, I do say. What cannot be chosen but is required for us to have as Medicare beneficiaries is Medicare Part A, Medicare Part B. Notice a plus sign there together. Underneath that, you'll see Part D, which is your prescription drug coverage. These are the coverages under Original Medicare that you can choose depending on your individual needs. Some people either are still working or have a spouse who is still working, and either one of those dynamics can produce medical coverage under an employer. So that's something that we could dive into at not today's presentation, but if you needed some more information on that, we can definitely counsel you on that. But that's what Original Medicare is comprised of. Another option and an only option that's available to individuals who have Original Medicare is a Medigap plan. Some of you may heard the word supplemental coverage. Supplemental is also another term that's referred to a Medigap plan. So if you are a beneficiary who has Original Medicare, you are only allowed to purchase a Medigap or supplemental plan if that is the coverage that you have. Now let's look into a Medicare Advantage plan. A Medicare Advantage plan, if you notice, it's one big box. So a Medicare Advantage plan does exactly that. It bundles the coverage options that you are seeking. If you see in the box, it also refers to a Medicare Advantage plan as Part C. So when we hear a TV commercial or get some literature in the mail and you are told you have to hurry up and get a Part C plan, it's only available for a certain amount of time. Part C plan is also another way to refer to a Medicare Advantage plan. So when you hear the two, it means the same thing, just a different verse that people are using to refer to that specific plan. The Part C or Medicare Advantage plan is bundling of your Medicare's Part A, Part B, and notice in parentheses it says usually Part D. The reason for that is because some Advantage plans don't offer prescription drug coverage. So you could have a Part C, otherwise known as an Advantage plan, that is only Medicare Part A and B. When you are looking for information on Original Medicare and an Advantage plan, this is the website that you can easily go to and access that information. You can find it online at www.medicare.gov. This is also the website that our agency uses when we're counseling beneficiaries and their family members or their caregivers. So the information on here is also provided through CMS. So when the information, if you're looking for the most current and correct information, this is a good website to go to. So one other thing that we'd also like to share with you today is the changes coming to Medicare in 2025. So that's why most of you are probably here today because you're wanting to know what some of those changes are that you are going to be seeing in your Medicare coverage. What you see here on the screen is for the year of 2025, there's going to be a $2,000 cap on out-of-pocket prescription drug costs. That's also a combination of your deductibles that you may or may not have to meet, any payments that you make at the pharmacy when you're picking up prescription coverage. All that gets accounted for the $2,000 cap that you're required to meet for the year. There is also a very new benefit option. It's called the new prescription payment plan option. That plan, we are not going to go into detail, but if you do want some more information, we are more than happy to provide that to you. We do have some literature that we can also send to you, or you can visit us at one of our in-person consultations that we're doing throughout Medicare Fall Open Enrollment, and we can provide you with that. But in a nutshell, the new prescription payment plan option is an option that you can enroll yourself in, not through Medicare, but with your prescription insurance company directly. You would contact them if you need some ease in paying for your prescriptions that are maybe several $100s a month to fill. You can set a payment plan directly with your prescription insurance company on being able to afford your prescriptions throughout the year. For those of you who do have extra help or are on a Medicare savings program, there are some changes for you as well. These changes are as follows. You can change your prescription drug plan monthly. In the past, for the last several years, if you had a Medicare savings program or extra help, you had to wait every quarter to make a change. Now you can make it monthly. Also, you can change from an Advantage plan to Original Medicare by simply enrolling in a Part D prescription plan. Other things that are changing is that you can no longer change from Original Medicare to an Advantage plan outside of open enrollment. You can only change in Advantage plans during the Medicare Advantage plan special enrollment period or during the fall open enrollment window. The Medicare Advantage plan special enrollment period, for everyone who is concerned about that begins January 1st and it ends March the 31st. Okay, so what can you do during Medicare Fall Open Enrollment? Medicare Fall Open Enrollment begins October the 15th, so that is on Tuesday. And these are the things to keep in mind when you are ready to make some changes or just inquire about what options you have. But before you're going to do that, you want to prepare. And these are some of the items that you would need to do so you can prepare for Medicare Fall Open Enrollment. What you need to do is carefully review your current plan. So your 2024 plan, you need to look at that, and you need to look at your annual notice of change that should have arrived in the mail to you already of any changes that are going to happen to your 2025 plan. You can compare the two. You can even call your insurance company if you did not receive any of that literature and ask them to mail you that so you can carefully review the current plan and how it's going to change for 2025. You're going to need to think about changes to your health in the past year and any of your upcoming health needs. If you've seen the doctor, say mid-year or just recently, and there are conditions that are changing in your health, and your doctor is anticipating you to have to participate in maybe more doctor's appointments or possibly change a prescription or take a new prescription that you haven't had to take. Those are things that you need to think about. I would also advise you that maybe you could just jot those changes down. So if there's an anticipation of a specific prescription that you may need to take, you can also inquire with us or on Medicare.gov to see what that prescription is going to cost you next year. You can explore plans using the Plan Finder on the Medicare.gov website, or you can give us a call at ADRC. As you can see there on the number on the screen, if you can write that down, it will be also presented to you throughout the presentation if you don't catch it this time, but you can call ADRC at 1-800-432 2080 for information and assistance. We do have option counselors who are actively going to be answering the phones and assisting with either giving you the information on where to locate us out in the state of New Mexico for in-person consultation or questions over the phone. Some of those questions can be answered, or scheduling yourself a phone appointment. So during open enrollment, here are some more options. You can be changing from original Medicare to a Medicare Advantage plan. This can happen starting October 15th through December the 7th. You can change from a Medicare Advantage plan back to original Medicare. You can switch from an Advantage plan to a different Medicare Advantage plan. So you've got three options here of changes that you can already make. Some people, as soon as they turn 65 or become eligible for Medicare, they sign up for a plan and they never change it. They're on it for 10 years because they didn't know they could change, or they thought, oh, it's covered fine. My rates go up and down, but it's okay. But it's best to kind of look to see if you can save yourself some money, because I do know, and everybody knows, that we need more money in our pockets nowadays. You can also switch from a Medicare Advantage plan that doesn't offer drug coverage to a Medicare Advantage plan that does offer drug coverage. You can switch from an Advantage plan that offers drug coverage to an Advantage plan that does not offer drug coverage. I'm sorry, I just flipped those around. From an Advantage plan, you can change one that doesn't have drug coverage and one that does. You can also join a prescription drug plan on its own. You can switch from one Medicare prescription drug plan to another different prescription drug plan, or you can also discontinue your prescription drug coverage completely. Please make sure that if you are dropping your prescription drug coverage, that you do have other credible prescription drug coverage so that you wouldn't be faced with any penalties in the future. And all of these changes that you can make, where can you go do that? As we indicated before, you can do that by visiting www.medicare.gov. Now, on that website, what you can do is you can select Find Plans Now. When you click on Select Find Plans Now, you're going to be coming to a landing page just like this. You're going to be asked to enter your zip code, as you can see here on the screen. It is important that you provide your zip code. When you provide your zip code, if you're a person who either has an Advantage plan or is going to enroll into an Advantage plan, or a prescription drug plan, you want to make sure you provide your zip code. Your zip code is going to notify Medicare.gov that the plans that should only be displayed to you are the ones that are available in your area. You do not want to sign up for a plan if you live in Farmington, New Mexico, but then the plan that's being shown to you is in Roswell, New Mexico. Far from each other, so you want to make sure that you are putting in your zip code. Another real nice feature about visiting Medicare.gov is what you see on your screen now. when you are comparing and researching plans, you can compare for the information of each plan that you're selecting side by side, just like we see here. These are just some random examples. No one is favored. They just landed in this order. Here you can see a comparison of three different plans. We've got Humana Choice. Notice in parentheses that one says PPO. You've got AARP Medicare Advantage, also PPO, but we're also comparing them side by side with an HMO plan provided by Blue Cross. The great thing is when you're comparing them side by side, you can see really nice and neatly in these straight lines what the differences are. So for example, the maximum you pay for health services, we can see a difference just spanning this briefly. We can see there's a $6,700 in and out of network cost for this plan. Here's a $5,700 amount, and here's a $3,900 amount. So these are things to consider. Whatever is most important to you and your healthcare needs, that's how you need to make your decision. Here on the bottom as well, you can see several green check marks and some red X's. You can simply see when you're comparing plans side by side what benefits that these plans offer and what they do not. So considering when choosing a new plan, you want to know, are your providers in network? So your physician that you've been seeing for years, or your physician that's going to retire and is recommending a new physician. You want to see if those physicians or those providers are considered in network for the plan that you currently have. If you're going to decide to keep them, are they going to be considered in network next year? Or if there's a different plan that you want to explore, is that physician or that provider going to be considered in network? You also want to consider, are your drugs on the plan's formulary? Is your pharmacy a preferred pharmacy for the plan? And what additional benefits are offered by the plan? Some people want a vision coverage. Some people want hearing coverage. Some people need transportation services. So that's something that you need to consider when choosing your new plan. What are you going to need next year? And lastly, how will changing your plans affect your cost? A big driver for the decisions that we make is how are the plans going to affect our costs? Those are things that we can definitely see. Okay. So next, Kelly's going to go into some SMP guidelines for you throughout Medicare follow-up and enrollment.
Thanks, Melissa.
Excuse me, could I just make one comment?
Please.
I just noticed that Kelly said that the phone number is 800-432, but the PowerPoint had 423 as the prefix. So maybe you'd like to fix that PowerPoint. See what I mean?
Thank you.
Okay, thank you. It's a great presentation.
Thank you.
Thank you. Does anybody else have any questions before I move on? Okay. So we're in the season of Medicare advertisements, and a lot of those advertisements out there are misleading. You can sign up for our scam alerts on our website, which is aging.nm.gov, and you would go to the home page and scroll about halfway down the page to the popular resources section, which is shown here, and then select the receive scam alerts tile to sign up. And that you can see that here circled in red. Next slide, please. So plans are allowed to send you emails and or direct mailings, but it's advertising. And what you should do if you have questions is simply call us. So we're the place to go for official, unbiased information. Don't stress out about the mail and everything that you're receiving. That's why we're here. So just keep in mind that they are allowed to send them to you, but you're not required to look at them. And just call us if you have any questions, and then you can simply throw all that junk mail into your paper shredder and forget about it. And there are rules for the emails. Plans are allowed to send emails, but they must provide an opt-out option. And I'm always leery of emails with links. I tell my clients, don't ever click links in any emails. But just know if you see these emails with this link, it is a requirement. And plans are not allowed to send unsolicited text messages or call you or visit you in person to market their products without your permission. You want to be very careful if you are at any kind of event, and if there is an insurance company representative there, be very careful about what you sign. Make sure you know what it is. Even if it's a sign-in sheet, you could be exposing yourself to solicitation. Next slide, please. And when should you walk away? If anyone pressures you to join their plan, remember you can use the entire open enrollment period to make your decisions. You will not receive extra benefits for signing up early. So you have from October 15th to December 7th to make any changes. And then the changes would go in effect on January 1st. You should also walk away if anyone tells you they represent Medicare and want to offer you a service for free. If anyone claims you're missing out on entitled plan benefits or offers health screenings or other activities that may be perceived as used for cherry picking, or if anyone requires your contact information at an event for a plan for anything other than raffle purposes, remember they can't contact you without your permission. So be very careful about giving out your information. You could be giving permission for them to contact you. And if anyone informs you that you'll lose your Medicare benefits unless you sign up for a certain plan, remember, you can always call us for the official unbiased Medicare information. And with that, I'm going to pass it back to Melissa.
Thank you, Kelly. Okay, so how to contact us? We have fall open enrollment in person and telephone counseling, both which are already on our schedules. If you haven't done so already, you can contact our agency out in Santa Fe, and if you can request on where we're going to be and get that information throughout the state, we can provide that information for you. We are going to be at in-person events in many communities. You can call the ADRC for information, as I mentioned before. We're going to be in libraries, we're going to be in senior centers, we're going to be in community centers throughout the state. So you can look for us. Also in some assisted living facilities. You can use a beneficiary planning tool to make the counseling go smoothly and quickly. You can contact the ADRC for live or callback assistance, meaning that someone can help you when you call. If you have more than 10 prescriptions, a phone appointment is going to be scheduled for you. If you have less than that, they can assist you live. On the callback assistance, you can request to be scheduled on a phone appointment. There are 45-minute blocks. So if it's you and a partner that are going to both be needing an appointment, please do schedule those separately, because it's not that efficient to do two people at one time. Our appointment scheduling has already begun. It's already open to schedule yourself if you'd like to do that. So after this presentation, if that's something you think you're going to need, please do give us a call. And there's our number, 1-800-432-2080. The beneficiary planning tool for remote counseling, it gathers basic demographic information, your drug list and the dosages, and it's designed to support a smooth and efficient experience. That is a document that we provide for you at the in-person sites that we are providing counseling for you. This is one of the pages of the examples of that form that we will give to you. It is a two-page document that closes so that if you are waiting to see us in one of our in-person sessions, you can fill this information out and simply just cover it with the front page so that your critical information is kept confidential. The things that you see here are important for us so that if you do compare plans and you decide you want to enroll, this is the information we are going to need. If you see on the bottom half of the form, there's an area for your prescriptions to be jotted down because that is important for us to be able to provide for you is exactly how your prescriptions are going to be covered for 2025. If you're an individual who has has it written down on on an index card or a piece of paper or on your phone, if you have that already somewhere, just make sure you bring that with you so that if you're not going to jot it down, we can take those prescriptions and type them into the Medicare.gov website, which we will be doing when we're comparing plans for you. This form as well, we do retrieve it and then we do shred it so you can be ensured that nothing is kept floating around with your private information. Here on this form, what I do want to note to you, there is not an area to write your Medicare number on there. So make sure that if you are going to be visiting us at one of the sites where we are going to be located, that you bring your Medicare card with you if you don't have your number memorized, because you're going to need that number if you decide to enroll into a plan. So at this time, I don't know if there's any questions in the chat. Kelly, if there is, I can take those now. And if there's anyone else who does have a question, I don't think I saw any hands raised, and I do apologize, I wasn't looking at that. I don't see any hands raised. If there's anybody who has any questions currently, I would love to answer those now.
I don't see any questions in the chat, Melissa.
Okay, sounds good. Anybody else want to just shoot any questions out if you've got them? Okay. So what I do want to point out, those of us who already have Medicare, active Medicare, sometimes we've got questions mainly about the Plan B premium. Is that going to change? We did not get notification of the Plan B premium, so the $174.70. We have not seen that is going to change for 2025. If you do go to the Medicare.gov website, as we've talked about a few times throughout this presentation, you can see that there as well. Okay, so if we do not have any questions, and you do have questions after this presentation, please call our Aging and Disability Resource Center at the number you see on your screen. The options counselors or SHIP coordinators can answer them for you. For those of you who might have a difficult time seeing the screen, I'm going to just vocalize that number for you so you can jot it down. It's 1-800 432 2080.
Missy, I
Hello?
do see in the chat our colleague,
Yes.
Rockstar Kathy, has mentioned the update that we do have for 2025, which is the Part D national average premium of $36.78. And the maximum deductible is $590. And we did test it and check in the plan finder, and that $590 is already reflected.
Yes. Let's see, and I think I see something else. Okay, the question I see is interested in original Medicare enrolling next January, February. Can I get just A and B and add D and or Medigap later without penalty if I want it? So to the individual, I don't want any information. So based on your date of birth, I don't know when that is, so please don't disclose that. That is identifying information. If you can call our number, we would be more than happy to just give you some quick information on your question. Because this is regarding the penalty, so that all depends on your date of birth. I don't know when that is, but give us the call, and we would be more than happy to provide you that information to make sure you don't get faced with the penalty. That is important. Yay, I don't see any more questions. Okay, opportunities for more questions. Going once, going twice. All right. Okay, so today's presentation, as I indicated at the very beginning of the presentation, that it was going to be recorded. So if you're interested in learning more, aside from this presentation that we're giving, or if you want to see this presentation again, you can visit our ALTSD YouTube channel. We've got pre-recorded workshops and tutorials and more information. So if you visit our YouTube channel, you can click on today's presentation. Once it's been downloaded, it'll be accessible to you as soon as possible. Or you can just look at the other presentations we do have there. The great thing about that is that you can see at your leisure. You can stop, you can pause it, you can see it in pieces, jot down notes, what you need, whatever you need to do. So it's very, very convenient to be able to visit our YouTube website. I'm going to give you a few minutes. So if you're going to jot down the address, you can see it there highlighted in blue. Please do jot that down. The website is ALTSD New Mexico State -YouTube.
Thank you very much.
Oh. Okay, here we go. Almost clicked on the YouTube channel. We're going to go on a quick field trip there. Okay. So additionally, for the latest news, we do have social media locations where you can reach us. You can follow us at New Mexico Aging, and you can also subscribe to the ALTSD electronic newsletter. I'm going to give you some moments, so if you want to jot that down, every little character matters, so you can see what the most latest news is. For those of you who are writing, I'm going to go ahead and read that for you. It's HTTP, P as in Paul, S as in Sam, colon, // MAILCHI, period, M as in Mary, P as in Paul, / ALPSD, / sign hyphen up hyphen FOR hyphen E hyphen news. And remember, if you go to our YouTube channel and you didn't get, and if you try to sign up and you get an error, get on our YouTube channel and then you can access this presentation and get this address. What we also would like to provide with you today for today's presentation is our customer satisfaction feedback survey. This is imperative to us, important to us, it's precious to us because we do presentations often. We provide information that we believe that our community needs, but we don't know if it's exactly what you need unless you let us know. So providing your feedback would also direct us into what you want to know more of, or what you're interested in. So you can complete our brief survey. Here, kind of in the center of the screen, in the color blue, is a survey for you to complete. It's very brief, and I'm going to give you enough time so you can write that website down and complete the survey for us. For those of you who need some help, I will love to read it to you so you can write this down. And if you can take the time to do that, we would greatly appreciate it. When it asks for names of the presenter, once again, my name is Melissa, last name Luna, and my partner Kelly Dickerson. So the address that you can go on to whenever you've got some time would be https colon / www.surveymonkey.com / r / ACLED. And if you don't get it, you can go back to our YouTube channel and access the link for the survey. I would like to tell everyone thank you so much for being here and getting just the information you need just in time right before Medicare Fall Open Enrollment. Now you know how to get a hold of us in more than one way, whether it's virtually, whether it is by phone, or simply calling to see where we're going to be located at throughout the state. Once again, some of our social media platforms that you can reach us at are at New Mexico Aging, which is Facebook, X, Instagram, and YouTube. The staff from Aging and Disability Resource Center, Kelly and myself, really, really, really appreciate you being here. And the phone number there for you is there for you to jot down and call us anytime you need us throughout this Medicare Fall Open Enrollment. Thank you so much for participating and being here today. If you don't have any questions, you're more than welcome to log off.